As we enter into the 21st century, it's only fitting that we look to the future and wonder how medicine will change. Well, one physician in Albuquerque, New Mexico is looking in the exact opposite direction, some 3,000 to 5,000 years ago. Back to Health's Jason Cook tells us the story of a physician who's combining ancient Chinese medical principles with today's modern medicine.
When you think of Albuquerque, New Mexico, scenes from the Old West immediately come to mind. Fiery red sunsets, desert-like scenery, and historic adobe buildings that take visitors back to the city's founding in 1706. Needless to say, Albuquerque is not a place where you would expect to find a hotbed for acupuncture, which is based on the ancient Chinese medicine from some 3,000 years ago. Dr. JasonStein serves as the medical director of the Integrative Medicine Program at HealthSouth Rehabilitation Hospital in Albuquerque. The innovative program is one of the few in the United States that combines clinically valuable alternative therapies with conventional Western medicine.
I think rehabilitation, whether it's inpatient or outpatient here at HealthSouth, is the perfect environment for integrative medicine. These are people that are already doing exercises with their PT, functional skills with their OT, and verbal skills with their speech therapist.
From 1990 to 1997, visits to alternative medicine practitioners increased from 427 million to 629 million. There are more than 80 categories of alternative medicine, but acupuncture remains the fastest growing, with 3% of Americans currently receiving acupuncture treatments.
It's taken a long time because of the scientific model of Western medicine. Basically, when you're dealing with acupuncture, you have an individual, and you're dealing with that individual. There was a great article about a person with peptic ulcers. You have 10 people that come into an acupuncturist with peptic ulcer, they get 10 different diagnoses. You have 10 people come in with peptic ulcer to a Western physician, they all get diagnosed with peptic ulcer.
Technically speaking, acupuncture is a painless insertion of needles into the skin and muscle to stimulate beneficial medical responses. After looking at the patient's tongue and checking their pulse, techniques that are borrowed from ancient Chinese medicine, Dr. Stein typically selects 5 to 15 points on the body to insert the hairline-thin needles. Each point relates specifically to the patient's diagnosis, even though the needle may be placed in an entirely different part of the body.
Well, you can see I'm a 220-pounder, so I got a lot of fat on me. And sometimes in the belly, you don't even know they're there. And the fatty part of your legs, you don't know they're there. You don't feel them until they move the needle around and maybe hit a nerve or something, and you feel it, but it's not a pain. A lot of times the needle will go in and you don't even know they put it in.
Like many other patients, Ted Scarberry sought out acupuncture as a last resort to manage his unbearable pain. The National Institutes of Health has shown evidence of acupuncture's effectiveness with many other conditions other than pain management, such as arthritis, stroke, Parkinson's disease, stress, and even asthma.
My first reaction was I didn't believe too much about it, but I was in so much pain that I was willing to try anything to help, anything. Medicine didn't seem to help at that time.
Now, a lot of people try acupuncture after other forms of medicine have failed. How do you go about changing the attitudes to where they'll try acupuncture first?
To me, it's not a medicine or last resort. You're looking at an acupuncture treatment which could vary between $50 to $150 per treatment. Some treatments may go 6 to 10, some may go longer. But let's take knee pain, for example. If you're able to treat that knee pain as a first resort for 6 treatments and it gets better, as opposed to giving an MRI, not really, knowing what's going on, and maybe even going to surgery, that you're dealing with tens of thousands of dollars there. So from cost effectiveness, it's a very good standpoint. Now the other side to that is it's also very safe. The side effects are very, very low, as opposed to some medications and some surgeries.
Even though acupuncture receives most of the attention, the Integrative Medicine Program also offers massage therapy, biofeedback, guided imagery, lymphedema treatment, nutritional counseling, and pet therapy. HealthSouth contracts with a local massage therapy school for the massages, which have been beneficial for both patients and staff members.
There's lots of different things that go under the umbrella of massage therapy. How we're working with people here at HealthSouth in massage is basically the whole idea of compassionate touch. That the ability to have sensitive, trained hands working with people's muscles and their range of motion and just having them feel more comfortable in their bodies.
Similar to acupuncture, massage therapy has gained medical acceptance in the United States during only the past 20 or 30 years. The massages given at HealthSouth in Albuquerque, however, are not your typical back rubs. The therapists are specially trained and undergo about 700 hours of training and instruction.
There's not a huge difference between a back rub and a massage, other than that the person who's giving the massage has trained fingers and is possibly paying more attention to what they're actually feeling than your husband or your wife giving a quick little shoulder rub. You're working on people's muscles, you're working on their skin, you're working on their cardiovascular systems, their nervous systems, their emotions, and their spirit. And so the whole package of the human being is what we're touching when we do massage therapy.
HealthSouth's Integrative Medicine Program in Albuquerque has been successful for several reasons. Foremost is the communication and cooperation with the traditional Western physicians who practice at the hospital. Word of the program is spreading throughout Albuquerque, and Dr. Stein hopes to take it to other parts of the United States.
I want to be very clear that some surgeries people need to have, and some medications people do need to be on. But that's why we're doing it here at HealthSouth in a hospital, because it's a safe practice to have your acupuncturist and your physician in communication with each other.